Yeah.
I'll let you know.
Thank you. Okay, let's go ahead and get started. So before we get into the slideshow, I just want to ask you guys some questions. How many people have studied for an exam, walked into the exam, felt like I'm going to rock this exam, and then looked at the first 5 questions and it seemed like they were written in Greek? How many people have been there before? Okay. How many times have you gone through a question and you've been like, okay, all of these answers are right. How am I supposed to decide between all of these right answers? How many of you have been there before? How many of you have been able to get it down to 2 answer choices and say, I have no clue what the best way to go through this is? Okay, so this is what I'm going to be addressing today. So I'm Dr. Kelly Blaney, by the way, and I've spent a number of years looking at both how students take tests and how they prepare for tests, and to look at how are people who really do know this information still unsuccessful on test taking. And so what I've come to realize is that there's actually 3 parts to being successful on the test. The first part you guys are really good at. It's learning the content. So most students can come to me and say, I did terrible on this test, but let me regurgitate the entire chapter to you. I know exactly what's going on in the chapter, but I still can't do well on these tests. So the content piece is usually there for most students. By this time, you're able to read content and recall that content. The 2 places where students really tend to struggle is in test-taking skills, or using judgment or critical thinking skills for that content they use. And that's what I'm going to focus on today. But I do briefly want to touch on the 3rd point, because the 3rd point is equally as important as the first 2, and that's your coping strategies. What do you do when you want to put your head through the computer? Everyone been there? Yeah, right? What do you do when you begin to have that negative self-talk of, oh my goodness, I spent all this time studying and nothing that I studied came up on this test? What do you do in those moments? This is something that's personal. This isn't something I can stand up in front of a class and teach. I can't teach you coping skills because they are all individual to everybody. But it is something that you need to walk into a test prepared for. You need to walk into a test prepared for the fact that you're going to get frustrated, you're going to have some self-doubt, so what do you do about it? And figuring out what you do about that is a really key part of preparing for a test, because here's what we find. When students get tripped up on one question, that question is hard for them, they think it, they overthink it, then they start to get into a self-doubt cycle, and then they not only miss that one question that they really didn't know the answer to, but they miss the next 3 or 4 because they started to psych themselves out. And they aren't able to critically think through the next couple of questions because their confidence is so shaken. So one of the things that you want to focus on in your own time is, what can I say to myself to calm myself down? What can I do? It might be saying the favorite lyrics of your song to kind of just chill out for a second in your head. It might be taking that piece of paper and drawing a little daisy on it just to distract yourself for a second. But you really do have to figure out, what are my coping skills for when I get stressed out and frustrated during the test, okay? But today what I want to focus on is test-taking skills, and we're going to do this in 2 parts. The first part that I'm going to do is I'm going to put you in the head of your professors. What are we thinking about? What are we trying to prepare you for when we're writing test questions? The second part of what I'm going to address is then, how do you as students tackle those questions that we've written? So one of the best ways to be prepared, and one of the best ways to kind of decrease that anxiety, is to understand the test to the best of your ability. And that's what we're going to focus on to start with. So in general, in nursing school, there is a core group of question types that we're going to ask you. The majority of those question types are multiple choice questions. Reason for that, the majority of the NCLEX, your state boards when you graduate, is still multiple choice questions. So we want you to get really strong at multiple choice questions. Second most common that you're going to see are select all that apply, everyone's favorites. So second most common that you're going to see are those select all that apply questions. Then when you're in a class that has calculations, you're going to have fill in the blank questions. And the last 2 you're more likely to see on your HESI than in your classroom test. But those are your drop and drag questions, so put things in order. It's usually either a procedure or who's most at risk for something. And then the hotspot questions. So-and-so comes in with these symptoms. Where are you going to listen to their lungs? Where are you going to listen to their heart? And you actually click on it in the actual location on a picture. These are the box of questions that we are looking at when we are looking to write a test for you guys. We're not writing short answer, we're not writing fill in the blank, we're not writing essay questions on exams because those don't show up on the NCLEX. So one of our top goals when we're preparing tests for you is to get you ready for the NCLEX. Our second top goal is to make sure that you can critically think through clinical scenarios. And that's going to be done by looking at different ways to ask questions. So, has anyone here ever heard of Bloom's taxonomy before? So I've got a few yeses. Bloom's taxonomy is another theory. This one comes out of education. And what Bloom's taxonomy says is that there are 4 different types of questions you can ask on any given subject. You can ask a recall question. Recall question would be, where is the tibia? There's going to be 1 right answer that's clearly right and 3 clearly wrong answers in a recall question. You either know where the tibia is or you don't. There's no critical thinking involved in a recall type question. Comprehension, we begin to look at a little bit more in depth at critical thinking skills. So a comprehension question might be, what would you do if someone had an open tibia fracture? Now we're at a point where you don't so much need to know specifically where the tibia is, you need to know about what to do for an open fracture. So now you're going to be able to critically think a little bit through, do I take care of them physically or psychosocially first? Do I take care of their airway first or their circulatory system first? Now you're able to use a little bit more critical thinking skills. What's happening in comprehension usually, though, is that in the stem of the question, it's very clear what we're asking you. So that critical thinking piece comes into play when you get to your answer choices. Application is now where we're really getting at critical thinking. So an application level question would be something along the lines of, someone has been admitted with an open tibia fracture. What would you find most concerning? What would the nurse find most concerning? So now you're not so much just looking for an open tibia fracture. That is not your topic. You have to critically think and realize that your topic is the most concerning complication of a tibia fracture. So that's what you're really looking for, is the first part of when you get to application is you have to critically think through the stem and figure out what on earth is this question asking, and then you have to critically think through your answer choices. So now we're looking at much higher levels of critical thinking that are required. Analysis is going to be your highest level of critical thinking. These would be along the lines of the who would you see first questions. So you're working in an ER, who would you see first? Patient number 1, patient with an open tibia fracture. Patient number 2, signs and symptoms of an MI. Patient number 3, signs and symptoms of a stroke. Patient number 4, smoke inhalation. Who would you see first in that scenario? We're still testing that content that I started with. We're still testing, do they know anything about the tibia? Now specifically an open tibia fracture. But to be able to answer these questions, you have to be able to pull in knowledge from other subject areas that may not have been covered in lecture over the last 3 weeks. They may have been covered in lecture a year ago. They may have been covered in lecture 6 months ago. But you are required to continue to build on your knowledge to know, is an open tibia fracture more concerning than an MI? Is an open tibia fracture more concerning than a stroke? Is an open tibia fracture more concerning than smoke inhalation? And you really have to utilize your critical thinking skills like that. Does that make sense to you guys? Now here's the thing. On the NCLEX, when you start your NCLEX, you start at application. You do not want to go down to comprehension or recall, because once you go down here, you are failing the test. Even if you start answering questions right in this area, on the NCLEX, once you get below application, you are failing the test. So what happens on the NCLEX is you start at application, and your job is to stay there. So our job is not to make you rock stars at recall recognition and comprehension level questions. Our job is to make you rock stars at application and analysis level questions so that you're able to answer these questions when you graduate so you can actually do something with your degree and become a registered nurse. Okay? So what this means is, how are you studying? When you're studying, are you saying, okay, I can define this disease process, I can tell you the symptoms of this disease process, I can do this basic level recall, and then I feel prepared. If that's where your preparation stops, that is why you are struggling on your tests. Because we know you guys can recall. You wouldn't have gotten to this stage in nursing school if you couldn't recall information. We're not going to test you at recall. When was the last time you saw a question that you read the thing, you said, okay, this is what it's talking about, and there was one right answer that was clearly right and 3 answers that were clearly wrong? Doesn't happen very often, right? Majority of what you're seeing is application and analysis, where there are 4 plausible answers. They are all correct in their own way, but only one is the most concerning, or only one is your highest priority. You may have to take all 4 of those steps to care for that patient, but only one of those is going to be the most important step. Or there may be 4 things, and they're all concerning for that patient, but only one is the most concerning. This is the level that you need to be thinking at. You need to be saying, okay, I understand the process now, I'm able to recall it, but how do I actually apply that now? So I'm going to back up and take us actually out of nursing for a little bit, and I'm going to show you the same way if I were to write questions in the real world on something not related to nursing. So if I were to write a recall recognition question, which of the following is required to open the front door of your house? So here I've got a clear topic, opening the front door of my house. Turn on your car. Is that required to open the front door of your house? No, right? Put the key in the lock. Is that required to open the front door of your house? Yeah. Put on your shoes. Is that required to open the front door of your house? No. Eat cake. Is that required to open the front door of your house? No. So here we clearly know that there's 1 right answer and 3 wrong answers. We are not testing you at this level anymore. That was A&P, that was many semesters ago. You need to be studying beyond, can I just recall what is the first step in opening the front door of my house? Now we go to comprehension. So same topic here, opening the front door of a house. Which of the following is required to open a front door of a house? Select all that apply. A key, is that required to open the front door of your house? Yeah. A lock, is that required to open the front door of your house? A doorbell, is that required to open the front door of your house? A door, is that required to open the front door of your house? Yeah. And a screwdriver, is that required to open the front door of your house? No. So here we can see 1, 2, and 3 are all, or 1, 2, and 4 are all required to open the front door of our house. But where people start to get tripped up with comprehension is now they're able to let in those what-if thoughts. What if I was locked out of my house? Then I might be able to open the door with a screwdriver, right? Well, what if I rang the doorbell and someone opened the door? Then technically the front door would be open. But that's not what the question's asking. It's asking what's required to open the front door of your house. It's not asking how do you break into your house. And it's not asking how do you get someone to answer the front door. If there's one thing that you take from me today, it's this. What if is the most dangerous phrase you can say to yourself during any nursing exam. Because what happens once you start saying what if is you are now creating your own question. You are no longer answering the question that your professor wrote for you. So what if equates to, I'm not going to answer the question my professor wrote for me, I'm going to answer the question that I'm going to make up in this moment. Okay? So what if is the most dangerous phrase that you can ask during any nursing exam. Now, continuing with our same phrase here, going to application. Which of the following is an expected outcome of opening your front door? So like I said, here we have to start thinking about what is our critical thinking in the STEM and where is our critical thinking in our answer choices. So critical thinking in the STEM is coming up with a really solid topic. When you are answering a nursing school question, your question or your STEM you should make into a topic that is no more than 2 to 3 words. So you should take all of the information that you're given and you should say, okay, if I had to summarize all of this information in 2 to 3 words, what would that summary be? Once you do that, then you are ready to go and take a look at your answer choices. So if I were to take a look here, what is my key words here? What am I actually looking for? What do you guys see? Any thoughts? Outcome. Okay? What is the expected outcome? I have to hold on to that, because if I don't hold on to the fact that I'm looking for an outcome, every single one of these answer choices are going to look right because they're all part of a process. So if I take a look here, the key goes into the lock. Is that an outcome of opening the front door? No. The lock unlocks. Is that an outcome of opening the front door? No. You are able to enter, exit the house. Is that an outcome of opening the front door? Yeah. You take your keys from your pocket. Is that an outcome of answering the front door? No. So number 3 is clearly your right answer if you do that critical thinking at the beginning and say, what is this question actually asking me? What is my topic here? My topic here is outcomes. 1, 2, and 4 are part of the process. Number 3 is the only thing that's the actual outcome. So that's where that critical thinking comes into play. Now, same topic, but we look at an analysis level question. When opening your front door, what is the priority action? Okay? So here, what is our topic? Priority, what does that mean to you guys? Most important, right? So what's the most important thing for opening the front door? So if we take a look here, turn the key in the lock. Is that important for opening the front door? Yeah. Take the key out of your pocket. Is that important for opening your front door? Do you have to get the key out of your pocket to be able to open a front door? Yeah, right? Put the key away. Is that important for opening the front door? No. That means that the process is done. So 3 is the first one I can throw because it's just wrong. And number 4, push open the door. Is that the priority for opening the front door? No, that's part of the process. So in this case, 1, 2, and 4 are all part of the process. So now you have to ask yourself, what is the one thing that has to happen before the rest of the things can happen? So are you going to turn the key in the lock before you take the key out of your pocket? What happens first? 2, right? You have to take the key out of your pocket first. Are you going to take the key out of your pocket before you push open the front door? No. Well, you're going to take the key out of the pocket before you can push open that front door, right? So number 2 is the priority here. Number 2 is your priority answer because before you can do any of these other steps, even though they're important, number 2 has to happen first. You have to get that key in your hand. And when you're looking at analysis level questions, what you have to be looking for is which one of these answer choices is taking the key out of my pocket. Which one of these answer choices is the most important thing for me to do first so that I can eventually accomplish everything else that's going on in that scenario. Okay? So when I'm sitting as a professor and I'm writing questions, I am only writing questions for you guys at your application and your analysis level. So this is one of the pieces I want you guys to be reflective of. When you are studying for your exams, are you studying for application and analysis level questions, or are you studying for recall comprehension questions? If you are studying for recall, can I just say what this is? Then that is an explanation for why it seems like it's a foreign language when you actually come and sit down. Because here's the thing. Let's use an example. You have a patient that you're caring for who's been admitted to the hospital for heart failure. You walk into the patient's room and they have suddenly become short of breath. Does the patient want you to be able to say, well, it looks like you're in left-sided heart failure because of these symptoms, this symptoms, this symptoms, and this symptoms? Or does the patient want you to help them be able to breathe? What's the patient's priority there? Help them to be able to breathe, right? They don't care. They assume that you know the process of left-sided heart failure. They don't need you to regurgitate it to them in that moment. What they need you to do is to know what the most important first step to take is when someone has suddenly gone into left-sided heart failure. And that's what we're testing you guys on. We're testing you not could you tell the patient in descriptives what's happening to them. We're testing, do you actually know what your first step should be when you see these different symptoms? Okay. So now we're going to change gears for a minute and we're going to talk about how do you actually, now knowing how we write questions, how do you utilize this when you are taking tests? And the bottom line here is that this is not a test, and any of your nursing tests are not tests of recall. They're tests of critical thinking, clinical judgment. In every single test question that you receive, we are asking you to make a clinical judgment about the scenario that you have been given. So that is the level you need to be studying for. You need to be studying for, okay, once all of this is going on, what clinical judgments would I need to take to keep my patient safe? That's the level that you need to be studying at. So we're going to go through some basic test-taking exams test-taking rules for NCLEX-style questions. And I'm going to go through all of these more in depth. But the first is you have to identify the topic of your question. If you do not know what the topic is, if you haven't critically thought through that STEM, there's no way you're going to come up with the right answer because you don't know what the question is actually asking you. So the first thing that you always have to do is say, okay, here's all this information that I've been given. What is the most important thing that's happening here? How do I describe that in 2 to 3 words? Once you describe it in 2 to 3 words, anything in that STEM that did not make it into those 2 to 3 words is background information. That stuff that you've clinically made the judgment is not as important for. Okay. The second is what I've actually been doing with you guys. Did you see me at any one of these say which one of these is the right answer? Or did I go through and say which one of these are the wrong answers? How did I approach it?
Wrong answers.
What are the wrong answers? You have to select your answers based on elimination. You cannot select it based on what looks right to you. Because again, oftentimes, all 4 answer choices are correct within the process, but only one is the most important. So if the first thing you read looks right to you and that's what you select, you are probably going to get that wrong because yes, that was correct in the process, but it wasn't the most important step in the process. So what you have to do is you have to say, okay, first of all, is this completely right or is it completely wrong? If it's completely wrong, then you throw it out. But if it could be right, you don't just select it. You go on to the next one and you say, okay, this one, is it completely right or completely wrong? If it's right, then you compare between the 2 answer choices and you say, between these 2, which one is a higher priority? And whatever's not the higher priority, then you eliminate that one. And then you go on from there. So an example that I'll give you that in a question that students have struggled with in the past with me is this question itself gives all kinds of background information about the patient. Talks about their health history, talks about their social, gives all kinds of background information. But the last line of the sentence says, which of the following medications requires blood sugar monitoring? Okay? So this is the first tip that I want to give you guys in terms of selecting topics. Always read your last sentence first. Start backwards. In the stem of a question, always read that last sentence first, because that's actually telling you what we're asking you. Everything else could be background information, and that's the case in this question. The question's actually asking which one of these medications requires blood sugar monitoring. All of the patient's history was background information. That wasn't relevant. But you can easily get distracted if you start reading from the top to the bottom instead of starting with that last sentence first. So now we say, okay, we know our topic. Our topic is what requires blood sugar monitoring, or blood sugar monitoring to get it down to 3 words. And then answer choice number 1 is prednisone. Steroids, does that require blood sugar monitoring? Yes, okay? And most students are so excited that they actually saw a drug that required blood sugar monitoring that they're like, okay, steroids, that does, I know it does. I'm going to select that, I'm going to be right, I'm going to move on. And then answer choice number 2, if they had looked at it, was a beta blocker. Nothing to do with it. Answer choice number 3, was an ACE inhibitor. Answer choice number 4 was an insulin drip. Is it more important to monitor blood sugar with a steroid or with an insulin drip? Insulin drip, and that's something that you know, but you missed that question because you looked for what looked right to you, and as soon as you saw something, you selected it, instead of going through every single answer choice and selecting the answer based on the fact that you've eliminated the other 3. Okay? The next one is don't use background information unless absolutely necessary. Once you've got your 3-word topic, do not pull in anything that you've said is not as important. A lot of times what students do is they come up with their 3-word topic and then they see an answer choice that's related to something in the background and they talk themselves into that. If your gut instinct did not tell you that that was the most important thing in the scenario, stick with that. That means that that answer choice that's related to the background information is a distractor answer choice. It's trying to distract you away from what was the most important thing in that clinical scenario. The 4th one we talked about, do not read into the question. These are your what ifs. You do not want to say what if in any way, shape, or form. What if, again, means you're creating your own question instead of answering the one that I wrote for you. And how likely are you to get the right answer of a question that you made up instead of the question that I made up? Not so likely. Okay? You want to be answering the question that I made up as your professor. And then the last one is another part where people tend to really skip. Think about what the answer choices really mean. When you are taking a nursing school test, the answer choices are never meant to be left alone. The answer choices are meant to be taken to outcomes. So you do not choose an answer choice that says, give insulin, simply because it says give insulin. You choose an answer choice because the outcome of giving insulin is that their blood sugar will decrease. For those of you who tend to get stuck between 2 answer choices, it's usually because this step is being skipped. They're trying to decide between the 2 answer choices exactly as they're written, instead of thinking about what is the outcome of these 2 answer choices and which outcome is better. So like I said, we're going to talk about each of these more in depth. When you first see a question, the very first thing I want you to do is cover up those answer choices. So take your hand, cover them up on the screen. The reason why I want you to do this is I want you focusing on the critical thinking of the STEM. If when you read the STEM, you can come up with a 2 to 3-word topic, wonderful. Then I want you to go to the answer choices and start the elimination process. But a lot of times, you do not know just from reading the STEM what the topic actually is. And in that case, you have to look to the answer choices for guidance. You're not looking for a right or a wrong answer choice at this point because you actually don't know what your topic is. What you're looking for at that point is what are these answer choices about? Because here's the thing, each answer choice represents a possible topic. So answer choice number 1 is related to that, that's a possible topic. Answer choice number 2 is related to this, that's a possible topic. Answer choice number 3 is related to this, that's a possible topic. And answer choice number 4 is related to this, that's a possible topic. So then you say, okay, out of my 4 possible topics here, which is the one that requires my attention the quickest? Which one has to be my focus in this moment? Now you've got your topic, now you can go into elimination for your answer choices. So to show you an example, if I was writing a test question, I could write a test question like this. A person had chicken for dinner, she needs to do the dishes, what should she do first? Here I have a pretty clear topic. What is she about to do? Dishes. She's about to do the dishes, right? So here we're about to do the dishes. My topic would be doing dishes, and I'd be able to move to elimination, okay? But I could also make the exact same question, but just make the STEM this. A person has just finished her chicken dinner, what should she do first? Do you have any clue what the topic of this question is? No. I'm requiring you to do some critical thinking to figure out what the topic of this question is. So this would be a case that you would say, I don't know what the topic of this question is, so I'm going to uncover my answer choices, and I'm going to see what these answer choices are related to. Answer choice number 1, rinse the dishes. What's that related to? Doing what? Washing dishes. Answer choice number 2, put the dishes in the dishwasher. What's that related to? Dishes. Answer choice number 3, strap the refuse on the plate into the trash. What's that related to? Doing dishes. And answer choice number 4, putting soap in the dishwasher. What's that related to? Doing dishes, right? So all of these are related to doing dishes. Now I have my topic. Now I know my topic's doing dishes, and I can now move on to elimination because I have my topic in 2 to 3 words. Okay? So this is what you have to do. The first step is to say, can I, from the STEM alone, come up with a 2 to 3 word topic? If I cannot, then I have to look to my answer choices and figure out what my topic is. Remember, you cannot look for a right or a wrong answer until you have your 2 to 3 word topic. If you jump forward, you have not completed the critical thinking that's required for that question. So for elimination, so now you have your topic, you're moving on to elimination. You have to eliminate answers in order to find the correct answer choice. That's what we talked about. Don't look for just the first thing that looks right, because even though it might be right in the process, it may not be the most important step in the process. Read each answer choice. Does it answer the question? If it does, then you leave it in. And only in your first go through, eliminate the ones you know to be wrong. Okay? So let's take a look at this in a question. A person is getting ready to take a shower after a stressful day at work. What should they do first? So if we take a look at this question, what are they getting ready to do? Shower. So what's our topic here? Showering. Okay, so now we're saying, okay, my topic here is showering. So I take a look. Number 1, put on clothes. I'm on elimination now. Is that a correct answer choice if someone's getting ready to shower? No, so that one I can clearly eliminate. Number 2, turn on water. Is that something you have to do to take a shower? Yeah, so that one stays in. Number 3, take off shoes. Is that something you have to do to shower? Yep, so that one you're going to leave in. Number 4, meditate. Is that required to shower? No, so that one you're going to throw out. So then we're left between 2 and 3. So how do we decide between 2 and 3? Now we're going back to taking the key out of your pocket. So what do you guys think? Without putting a what if in there, do you get undressed and then turn on the water, or do you turn on the water and then get undressed? You get undressed and then you turn on the water. The only way you can justify turning on the water first is if you say, what if it takes a really long time for the water to heat up? Okay? Does it say anything in the STEM that it takes a long time for the water to heat up? So that's not a relevant piece of information. So what you are focusing on here is not putting in the what if. Now, if you don't believe me and you really feel the need to put a what if into a question, then I ask that you do this. You say, what if it takes a long time to turn on the water for the water to heat up? And then you do a what if that's the direct opposite of that. What if the water comes out steaming hot? You have to ask yourself what ifs in both directions. If the what ifs in both directions cancel each other out, then that is not a relevant what if, and it is not relevant to your scenario. Okay? So if you really can't let go of saying what if during a test, then say what if in opposites. What if this happens, what I'm thinking, but what if this other thing happens that's the direct opposite of that? They cancel each other out, which they usually do, then that's your reminder to yourself that that what if really is not relevant to this current question. Does that make sense? Now meditate. Why is meditate in there as an answer choice? What's that trying to do? What's that related to in the STEM? Stressful day at work. Meditate's trying to pull you back into that background information. When we came up with the topic, did anyone here say stress is our topic? No. So just because meditate's there does not mean you bring back in that stressful day at work. Meditate would not be the right answer here because that's not what the focus of the question was. That's not what your 3-word topic was. Does this make sense to you guys? Okay. So just what we were talking about, do not use that background information unless absolutely necessary. After a stressful day at work was background information in this question. Also, as a reminder, do not make assumptions, do not say what if, do not say yeah but, because then you are making up your own questions. Now the last piece, and this is the piece, like I said, for people who really tend to get stuck between two answer choices. You have to think about what your answer choices really mean. To do that, I really like if-then statements. If I do this answer choice, then what will happen? If I ask this question, then what information will I gain? If I take this step, then what will be the outcome of that? So what you want to do is you want to take if and put your answer choice there, and then think about then what happens, and you make your decision on the then what happens, not on the if part of the statement. Again, going back to what we discussed earlier, this testing is about clinical judgment. It's not, can you read the answer choice and make a decision from that answer choice alone? It is, can you read the answer choice, think about what the outcome of it is, and then decide what is the most important outcome. You cannot just leave the answer choices as they're written on the screen. Okay. So if we take a look at an example of this, a person is learning to drive. They are afraid of parallel parking. What should the driving instructor do next? So what's our topic here? What are they afraid of? Parallel parking. So if I were to get this to 3 words, my topic would be fear parallel parking. Okay, so now I don't have to go back and look at that stem again. It's fear parallel parking. So then I take a look at my answer choices, and I see, tell them everything will be okay. I see, assess their knowledge of parallel parking. I see, ask if anyone in their family knows how to parallel park. And I see, teach them how to parallel park. And I say to myself, well, technically I could do all of these things, so how am I going to figure out what's the most important? Now you're going to do your if-then statements. If you tell them that everything will be okay, then there is no change in their parallel parking skills. Do you guys agree with that statement, that outcome? Okay, so we have one outcome. If you assess their knowledge of parallel parking, then you will know their existing skill set before you start teaching. Does that make sense? Okay. If you ask if anyone in their family knows how to parallel park, then you will know if their family can parallel park. Does that make sense as an outcome? Okay. And if you teach them how to parallel park, then they will know how to parallel park. Does that make sense as an outcome? So now I'm going to make my decisions on the then statements. So the first one, am I ever going to choose an outcome that's no change? No. So now I can easily throw that answer choice out, right? What about number 3? Is it relevant if you know if their family can parallel park? No. So then you can easily throw that one out. And now we're left with 2 and 4. So 2, is it good to know what their existing skill set is before you start teaching them? Yes. 4, is it good that they know how to parallel park? Yes. So 2 and 4 are both very relevant answers here. So how do you decide between them? Nursing process. Do you assess before you implement, or do you implement before you assess? You assess before you implement. So what's our answer here? Assess. Our answer here is number 2. And I want to kind of drive home for a second why assessing before implementing is so important. Assessing before implementing is so important because if you still have valid assessments left, then you do not know the whole clinical picture. If you do not know the whole clinical picture, then it is not safe to implement anything with that patient. And when it comes down to it, clinical judgment is a question of keeping your patient safe. Okay, does that make sense? Okay, I'm going to send this PowerPoint to your professor so that they can post it for you guys. You're also going to see at the end of this PowerPoint are some general test-taking rules. So those are good things to review as well. So it's been really lovely to meet with you guys today. I hope you have a great weekend, and I will let me know if you guys have any questions.
Thank you.